pledge will be led by the gentlewoman from Texas, Miss Johnson.
I'm here this morning just to address education. How do we know? Because the people have told us so. We represent the ideal way to alleviate the shortages is by ensuring that children of all races and both genders receive the basic grounding in science and mathematics that will prepare them to pursue careers as scientists, engineers, and technologists. Is it not time, then, for America to grow morally? For those who fear to answer this question, I will answer it for them. The time is now.
Now more than ever, what happens in Washington impacts us here in the Dallas-Fort Worth area. Your Congresswoman, Bernice Johnson, will help you understand what goes on inside the federal government and share perspectives from today's leading policymakers and opinion leaders. And now, your Congresswoman, Bernice Johnson.
Hello, and welcome to the Capitol Report. My guest today is Bill Vaughan, Senior Healthcare Policy Analyst at the Consumers Union. The Consumers Union was founded in 1936, and it is a nonprofit organization that works for a fair, just, and safe marketplace. The Consumers Union publishes the well-known magazine, Consumer Reports. Mr. Vaughan joins us to discuss our healthcare system from the patient's perspective. He has worked in healthcare policy for many years, starting at the Ways and Means Committee here at the House of Representatives in 1965. He retired in 2001 as staff director for the minority on the Subcommittee of Health, and since then he has also worked for Families USA. We're delighted that he's here, and welcome.
Thank you very much for having me. And I appreciate the plug for our magazine. It's we don't just test tires and toys and cars and things. We try to help people with what's a good insurance policy and also what's the safest and most effective prescription drugs. And I'd like to just make a quick plug for a free service that we have. It's absolutely free, called bestbuydrugs.org. And you see all those ads on television for take this and take that. They're advertising the most expensive new product out there, but it doesn't make it the best product. For example, there's something that can help fight heartburn, costs you about $200 a month. There's something just as good, over the counter, $20 a month. So before you buy into all those ads, check out our website on what's good, safe medicine that can save you a ton of money.
That's a great, I'm pleased to hear that. I just suppose that most people would love to hear that.
You can save tons. They're only going to advertise the things where they can make the most money, and these new products, you know, Americans like to think new is better. Isn't always true. In fact, on a new drug, it takes about 7 years for you to understand half of the adverse effects. So rushing out to get a new drug is not always a good idea. They're only tested on a couple thousand people for like a year. You don't know the long-term consequences on these new drugs. So unless you really need to take it, like you're fighting cancer or something, don't go rushing off for the new thing. Check out the old thing, because it's likely to be just as good and cheaper.
Well, let me ask you, have you had any personal experience with the healthcare system since leaving the Hill, or anything that reinforces any ideas?
I have, my wife has had, we've had to, I think she's okay. I think things are good, but we've had a scare. And it reinforces to me the importance of quality. That the American healthcare system, we spend so much more than any other country in the world. And most of the time it's pretty darn good if you got insurance. But even when you have insurance, you need to be able to sometimes go to another hospital or be able to switch doctors, and a lot of people are stuck in insurance policies where they can't do that.
Yes.
We need the kind of reforms that you all have been working on that would let people have some choices of plans and that would improve quality in healthcare.
Well, that's great. I hope we do get much of what we plan to get passed, because the people, whether they realize it or not, will certainly be helped by these changes.
Absolutely. Absolutely. People are really hurting, and particularly in Texas. You know, the great state of Texas, and I'm a Virginian, but the great state of Texas is the bottom of the barrel when it comes to insuring its people and the basic health of folks. And having insurance and being healthy, there's a relationship. It's not a perfect one, but they go pretty close together. So you're at about 30% uninsured. The rest of the country is at 16, 18%. Not only the whole country has to get reformed, but Texas ought to be leading the parade, and I know you are.
Well, we're trying, but there's still some resistance. We have the largest number of working people without insurance because they cannot find an insurance company that will insure them at any reasonable cost that they can afford. And passing this reform would go a long ways in correcting that.
Yes. It'll help make it affordable, and this, I think, is the key fight. The House bill's a lot better than the current Senate package, and hopefully the House will win in making sure that for the middle and lower income folks, this is an affordable package. It's essential to have these reforms because not only is it the cost that's killing the whole economy and individual families. I mean, this is, they say 50 to 60% of the bankruptcies in our country are caused by high cost of medical care. And 3/4 of those people had insurance. So what we've got is, even when you got insurance, a lot of it's pretty crummy. And or junk insurance. So people have to be careful of that.
Yes. For some reason, insurance companies are able to get by in Texas with very, very, well, actually unfair type coverage because they like young, healthy people. But those young, healthy people eventually get older, and as they get older, they'll need a little bit more medicine. As soon as they get to the point where they need an insurance company, they dump them to Medicare. So the insurance companies really make a lot of money on young, healthy people. I don't want young, healthy people not to carry insurance, and many of them have stopped because of that. They say they never use it, and the cost just keeps going up. By the time they are in a position or have a health condition to use it, then they have to depend on Medicare before their insurance will pay, which makes it such that the insurance company has drained off all this money all this time, and when they really get sick, they still just pay a bare minimum because they only pay what Medicare does not cover. Our insurance companies have really gotten by making a lot of money. I have not heard of any health insurance company going broke or getting into bad trouble because they know how to negotiate with these companies and get the best deals that they can get.
Well, that, and there's a lot of fine print. In fact, most people don't read their insurance policy because it's so boring and tedious. And you look at all that stuff and you just say, in fact, there was a poll by an insurance company that said people would rather go to the dentist than read their insurance policy. But I tell you, you need to read it. We came across in our May magazine an example of an insurance policy that said we cover hospitalization. Tiny little fine print. Said starting the second day. Well, the first day you go in, that's when you use the surgery room. That's when the tests are done. That's the big expensive day. Second, third, fourth, fifth day, you're just sitting in bed and, costs are kind of low. And not covering the first day, this family thought they were covered. Not having that first day coverage left them with like a $12,000 bill. It's that kind of ticky little fine print stuff that the reform bills that you all are working on should eliminate and should help us with.
Yes.
If I could, I give one other example of why you've got to pay attention to your insurance policy. Again, this May issue, we looked at two policies, one in the state of Massachusetts and one in California, and they look pretty similar. One had a monthly premium of about $400 for a 55-year-old person, and the other was about $250. The